an age when most people are graduating college and starting out on their own, Elisa Bantug was dealing with a diagnosis of cancer. Tonight, she is sharing her story of survival and the research that could save lives.
You know, Christian, breast cancer affects so many of us. You may be a survivor or have a family member or friend touched by the disease. But some people personally touched by it really have a vested interest that we're really one day getting closer to having a cure.
I was 23, and my life was turned upside down because of it.
Elisa Bantug's battle with breast cancer really began 2 years before that. She found the lump at 21, but fought medical professionals 2 years before anyone took her seriously enough for a mammogram. Disturbing, because there's a history. Her mom's a breast cancer survivor.
You know, I often think that if I didn't do that for myself and I waited until I was 40 to get diagnosed, I'm not sure I would be here today. I don't think anybody does.
Today, 10 years later, she's a health educator at Johns Hopkins, working to make life easier for young breast cancer survivors like herself.
My doctors are really good at curing cancer, but maybe not necessarily kind of treating the whole person and the quality of life pieces that accompany the disease.
A disease Elisa hopes researchers like Dr. Sarah Sukumar will one day find a cure for.
We try to study new drugs that can be used to kill breast cancer cells.
The Johns Hopkins oncology professor and her team are studying blood work of cancer patients in hopes of coming up with blood tests to detect a recurrence before traditional screenings.
If you pick up metastatic breast cancer early, probably you will be able to treat it more effectively and treat it more permanently than it is right now.
Every year, 40,000 women die of metastatic breast cancer. That's when the disease has spread to the body and becomes incurable. Research money from Coleman, Maryland, has enabled the doctor to study various aspects of the disease, from genetic markers in the nipple fluid of cancer patients compared to non-cancer patients, to the benefits of the spice turmeric.
What researchers have found in a clinical trial is that women who took turmeric, oral turmeric pills, had much better wound healing, had much better indices of repair of that tissue than women who did not.
Dr. Sukumar wants a cure for cancer survivors like her colleague, Elisa.
The word breast cancer brings dread to the hearts of the entire family. Why is that so? Because there is no predicting whether that woman is going to live for 1 year, 2 years, or 5 years.
It's been 8 years since Elisa's cancer recurred. As she fights to avoid another, she focuses on the future for her 2 daughters.
My daughter, who's 15 right now, has said to me many times over the years, do you think I'm going to get breast cancer? And she worries about it. She tells me that she feels her breast all the time, and she says things like, when will I start getting mammograms, or when will I start knowing when I should follow up with breast cancer screening? And that scares me, and that makes me really sad that she's not able to live her life and not worry about this disease. You know, and I have to reassure her that, you know, I can't tell you that you're not going to get breast cancer. I can tell you that there are places and people doing really great research, and we're working really hard. So hopefully that's not something that happens in your life.
Now, good news for Eliza and other breast cancer survivors. Komen National just announced that Johns Hopkins was awarded 2 new national research grants worth nearly $240,000. One is for diagnostic testing, and the other is to look at tissue samples. So that is great news. And you know, those screenings the doctors at Hopkins are working on are really important because cancer can come back even stronger than before. Now, on Friday on In Focus, we introduced you to this lady, Paula Brooks. She was treated for stage 2 breast cancer, but then a year later, a second diagnosis, this time stage 4. Her cancer was spreading.
I just felt that it was going to start spreading, you know, everywhere. And so that's why I was so depressed, because I was thinking I wasn't going to make it.
Now, doctors say stage 4 cancer is rarely cured, but it is thought of as more of a chronic condition that must be treated and managed. And for Paula, that means a clinical trial. She is right now stable with no growth in her tumors, but researchers don't even know if she's actually taking the study medication or the placebo. Doctors say most people see clinical trials as experimental, but they're actually based on a lot of evidence. They've actually had patients live with metastatic breast cancer for a decade or more, while others live for a shorter period of time. And today is actually National Breast Cancer Awareness, Metastatic Breast Cancer Awareness Day. So doctors are working to save the lives of people like Paula and Alyssa. With the research, though, it is very, very costly. That's why ABC2 is partnering with Coleman, Maryland for the 2014 Race for the Cure. It is coming up Sunday, October 26th in Huntington. Scott Valley, so mark your calendar. The goal is to raise $2 million, and for more information on how you can lace up your shoes and get involved and help out the cause, head to our website at abcnews.com/Komen.